This is a series. Hi, everybody. Good evening. So, today we'll begin with the series of lectures which is about sexually transmitted infections. This is subdivided into three headings. First, today we'll be discussing about PID, pelvic inflammatory disease. Second, we'll talk about STIs in general. And third topic will be pelvic tuberculosis, genital tuberculosis. So, while we begin, let me tell you there are two standard guidelines which you all must read. It is the CDC guideline on PID, which is considered as gold standard for treatment, diagnosis, management, and everything. First and foremost was 2015 CDC guideline. When I was appearing for my MD exam, I read the 2015 guideline. Now, currently, you have to follow the CDC 2021 guideline, and there are quite a lot of changes in it. So, if you're reading any of the old textbooks for PID, they might be giving you guidelines like diagnosis and management as per the previous guideline. So, I'll tell you simultaneously as we go on which are the changes which are there. So let's begin with today's topic, which is PID. I'll be discussing about number one, etiopathogenesis of PID with you all. Second, we'll be talking about clinical features. Now, is it visible?
Yes, ma'am.
Okay, so let's begin. We'll be covering PID under the following headings, which is etiopathogenesis, clinical features and diagnosis. Third, we'll be talking about treatment and management of this. Then we'll discuss about long-term complications and few special conditions of treating PID. Did you all attempt today's questionnaire? There were 7 questions today. Did you all attempt it? Please write in the chat box. Dr. Vishal. Hello, Dr. Vishal. Hi. So I wanted you all to attend today's questionnaire. So from now onwards, at least in my lectures, you will see that there will be a pre-test questionnaire. You will attend the lectures where answers will be given and do a post-test assessment of the same questions. So you can compare whatever you have learned and also gives me an idea how attentive you have been in the lecture. See, you can obviously go back and listen to the lectures if you're busy and occupied in your clinical work somewhere. But we want you all to, even if you're not attending the lectures by chance, आपको बाद में सुनना है, please do attempt those questions. It is very, very, very important. छोटे-छोटे questions that will help you through your OSCEs as well. कितने लोगों ने attempt किया है आज का questionnaire session? I think फिर उसी से start कर लेंगे हम लोग. How many have attempted? I want the scores of who all have attempted. So the first question was, PID is most frequent in which age group? As we go on to the lectures, हम लोग के सारे questions answer होंगे. We'll see what all were the questions that I gave you. We'll also see the answers, and if you have any doubts, you all can come back and ask me about those. Okay. So first question was, PID is most frequent in which age group? Options were 10 to 20 years. I'll write the options: 10 to 20 years, 15 to 25 years, 25 to 35 years, or 20 to 30 years. किस एज ग्रुप में PID मोस्ट कॉमन है? कैन एनीबडी राइट देयर आंसर्स? अभी भी लिख सकते हो आप चैट बॉक्स में, आई डोंट माइंड. Meanwhile, I will begin with the definition of PID. I am not going to write the answers. I want you all to attempt and write here. Any acute infection of upper genital tract in female involving any or all of the following, that is the uterus, the oviduct and ovaries. Oviduct is nothing but the fallopian tube, but since in the definition it is mentioned as oviduct, so that is how I've written here. Now coming to etiopathogenesis of PID. What are the causative organisms of PID? Can anybody enlist or write? By previous question का answer नहीं लिख रहे, please do type and write in the chat box. Which is the most common age group for PID? Options again: 10 to 20, 15 to 25, 25 to 35, and 20 to 30 years. Attempt fast. Rebote. Apart from the common organisms which you all know, that is number 1, Neisseria gonorrhoeae. Chlamydia trachomatis, Mycoplasma genitalium, tuberculosis in India. There are other organisms like Leptotrichia, Prevotella, Atopobium. There are certain anaerobes, sometimes E. coli also. E. coli कहाँ पे होता है? किन एज ग्रुप में PID कॉज करता है? Anybody? B. Vishal has answered. 15 to 25. You are absolutely right. It is 15 to 25 years of age group, which is the most common age group where you see PID. I think my screen video is not very clear. So moving ahead, talking about the microorganisms involved, microbiology behind what happens is there are certain defense mechanisms which are there in the female pelvic organs. So suppose this is your uterus, this is the cervix, fallopian tubes. Very bad at drawing, please excuse me. This is your vagina. So the cervical mucus plug and the vaginal flora, ecoflora, vaginal ecoflora, cervical mucus plug, the endometrial lining, the cilia present in the fallopian tube, everything acts as an intrinsic defense mechanism of the uterus or the pelvic organ. So the intrinsic defense mechanism is present with us. When this defense mechanism, any part of this defense mechanism goes for a toss and is exposed or bombarded with microorganisms from outside which can cause infection organisms which take the lead over defense, it leads to pelvic infections. Any kind of pelvic infections can be there. It could be cervicitis, it could be endometritis, it could be fallopian tube infection, it can be peritoneum, and as and when it goes upwards, the severity also increases. So the most common organism, can anybody write which is the most common organism? Again, that was one of the question. I have mentioned those organisms above. So both N. gonorrhoeae and C. trachomatis, depending on their area of prevalence, are considered as the most common organisms causing infection in PID. What is the most common organism in premenopausal group? Specifically, if they asked you premenopausal group, which is the most common infection involved, which is the most common organism, it is Mycoplasma genitalium. But don't consider that premenopausal group will include all the women of reproductive age group. That is not true. It is, if the question specifically asks you about premenopausal age group, it is Mycoplasma genitalium. Now, which is the most common organism in postmenopausal age group? So in postmenopausal age group, it is rarely caused by E. coli and the colonic, the anaerobes which are present in the colon. So they are responsible largely for causing PID in postmenopausal. So in postmenopausal age group, as such, the risk of PID is very rare. It's very low. It is rarely seen in postmenopausal age group. But if it is present, you have to suspect E. coli and anaerobes first, then go to more common diagnoses like N. gonorrhoeae and C. trachomatis.